Welcome back, everyone. We are having a fascinating discussion with Dr. Russell Blaylock. We're going to be talking more about his book, Natural Strategies for Cancer Patients. If you are someone that you know has developed cancer, you know you've got to have a strategy, and the natural strategy is best. Okay, Dr. Blaylock, what I learned that last segment was, I think my take-home message was the sixes. We all get too much sixes in this country. We know you have to have some sixes, but you're saying just by eating a healthy diet, I'm going to get what I need, so I really don't need to use extra. Extra converts to this thing called PGE2 in your body, prostaglandin something or another, which you can say again in a moment. That leads to total body inflammation, which leads to cancer.
Which goes to cancer,
so,
absolutely.
I need to understand a little bit more about this inflammation. Because, if you look at me, how do I know if I have inflammation?
I don't think I'm inflamed.
Right. They did a very interesting study. It took them a long time to do this. But they studied people who developed cancer, and they looked back to see, did they have diseases that caused chronic inflammation, arthritis, autoimmune disease, etc. And what they found, that in black people, 76% of them had a chronic inflammatory disease up to 12 years before they finally developed cancer. And when they looked at the white population, it was about anywhere from 9 to 10 years of chronic inflammation, and they finally developed cancer. So most of the cancers, you could pinpoint a chronic disease.
So this chronic inflammation would be like a lupus type or an arthritis type?
Lupus, rheumatoid arthritis, chronic arthritis.
Chronic sinusitis, bronchitis, it keeps you inflamed. Okay.
See, and there's a lot of things like that.
Oh, absolutely.
Because we're eating this diet with this inflammatory oils in it, most people are in a state of chronic inflammation.
And you don't know it.
And you don't know it.
You can't feel it.
You may feel a little achy, you may feel a lot of sorts.
Well, no
and most
wonder.
people that get on a clean diet, the first thing they say is, is, gee, I feel so much better. They didn't even know they felt bad.
They didn't even realize it. Doctor, we saw in our news today that currently some 20,000 people die every day from cancer, and by the year 2030, they're expecting some 46,000 people a day, and yet we spent billions in cancer research, and I feel like we're walking up a sandy hill. Every step we take, we slide down, but your research has led us to know that there are things we can do. First, correct that nutrition. You need high-powered nutrition. Number 2, correct the omega situation. You don't stop frying those foods. Get more fish and flaxseed in your diet. Third, calm this inflammation. Now, how do you calm inflammation? How do you do that?
Well, you just named one of the major ways, omega-3 fatty acids.
Omega-3s.
Omega-3 fatty acids are anti-inflammatory. They reduce inflammation. And this is what we see in these populations I talked about. They eat more omega-3 fatty acids, less omega-6, so they have much lower levels of inflammation. And when they measure these levels of inflammation, these people, that's exactly what they find. When they look at large populations of people and they measure inflammatory measures, they find out people who have chronically low levels of inflammation rarely get cancer. People who have high have very commonly developed cancer, and their cancers are very aggressive. When we look at cancer patients, for instance, look at patients who have breast cancer. If they're obese and they have inflammation, they have very aggressive cancers and they're more likely to die because obesity increases your inflammation. This is the connection between obesity and many cancers. It's that this visceral fat, the belly, it produces these inflammatory chemicals constantly. And so when you're obese, particularly abdominal obesity, and you can be thin and be abdominally obese.
Yeah, what they call the beer belly, right?
Or
that
even
pot
without
belly.
the beer belly, you can have so much internal fat.
Deep inside, right.
If you look at you think this is a thin person, but they're producing this type of fat.
I see what you're saying,
that produces inflammation, so they're in a state of chronic inflammation, and they develop cancer. Because what does inflammation do to you? It produces tons of free radicals. The free radicals are what are damaging the DNA that's producing the cancer.
Okay, so again, how do we get out of it?
Well, change the diet. Cut down on the omega-6, increase the omega-3, and all the human studies are showing people on the high diets like that have far fewer instances of cancer. If they develop cancer, they're more likely to survive.
What are your favorite sources for 3?
Well, I don't take it fish because of the mercury contamination of fish. And mercury is a carcinogenic substance. So you don't want to eat fish, particularly the fish with a more omega-3 fatty acid content, because they have higher mercury content. You want to eat, take the supplements that have been purified.
Right. There
And
you go.
concentrated. Now,
Okay.
it's the DHA component of omega-3 fatty acid that has almost all the anti-cancer effects. Now, here's the interesting thing about diet and foods. People don't trust it because they say that's just too simple.
Yeah.
What they don't know is what foods do in your body. And we know a lot about that now. I said we spent $100 billion on cancer research. So we know the cellular mechanism by which cancer grows and develops and invades. We also know now what foods do to those cell processes.
Oh, we do.
On a very molecular level, we know. So when we say eat spinach or curcumin,
Yeah.
now we know what it does to the cancer cell. What's interesting, it targets only cancer cells, and it protects normal cells.
What spinach
Now-
does?
All of these flavonoids that are in these plants, spinach and broccoli and Brussels
Now,
sprouts.
Cindy, Dr. Blaylock, the American Journal of Epidemiology just released the study, men and women who routinely eat spinach, cabbage, onions, apples, berries, and a long list of similar type vegetables and fruits have a significantly lower rate of developing pancreatic cancer, 25%. If they're a smoker, it was reduced by almost 60%. And they attribute it to flavonols. Is this the type of thing you're talking about?
Flavonols.
Flavonols. What is this
Well,
stuff?
that's a subclassification of a flavonoid.
Okay.
Flavonoid is sort of the big grouping. The flavonols are one of the subgroups. But these flavonoids are powerful, powerful cancer inhibitors and powerful for treating cancer.
Is that God's gift to us?
That's God's gift to us.
Isn't that a beautiful way to thinking
Because
of it?
when we look at the chemistry of it, molecularly, what are these flavonoids doing? They're changing the cancer cell's mechanism of action
Yeah.
and inhibiting it, while at the same time strengthening the effect of a normal cell.
Do you think it will come to the point where we could actually extract flavonoids, and make it a chemotherapeutic agent?
Oh, absolutely.
Absolutely.
This is a very hot area of research right now. For instance, they're finding curcumin is one of the most powerful anti-cancer extracts they've ever discovered.
Why aren't we giving it with the chemotherapy, doctor?
Well, because of the drug industry, it's making so much money in oncology.
But we can do it on our
Selling
own.
drugs.
Is it
Oh, you
safe
can
to do it on our
Oh,
own?
absolutely. I've used it in thousands of cancer patients. The whole time I was treating patients, I was putting them on these things.
Yes.
And one of the things you commonly hear is, your oncologist don't want you to take it because of the interference with treatment. It's antioxidants are
It's
bad.
not true.
Right.
Well, the research, and these are hundreds of studies, are showing it's just the opposite.
It's essential.
Not
Now,
only does it not interfere,
we-
but it enhances the effectiveness.
we have a break coming up, but I want you to explain in detail why it's okay for a cancer patient to take antioxidants. Folks, this book is critically important for all of us, not just cancer patients, doctors, nurses, all of us who care for the health of others and have family members or friends with cancer. Natural strategies for cancer patients. More when we return.